Women all over the world have to one day face the change, what we call menopause. But the telltale signs of impending menopause are different across the globe. Here in the West, we associate menopause with hot flashes. In Japan, it's shoulder pain and stiffness. In India, it's poor vision. In China, it's boredom, poor memory, and numb hands. The symptoms may be different, but the cause is the same. It has to do with a woman's hormones.
Menopause is a permanent cessation of menses that occurs as a result of decreased ovarian function. And basically what happens is your ovaries stop ovulating and producing estrogen and progesterone, and as a result, women stop getting their period, and that's menopause. You can't really define it typically until it's been a full year that they've had a period. Prior to menopause, there's this fluctuation in your hormones, and you're not ovulating regularly. And women typically will go through this transitional phase called the perimenopause or the climacteric, where they will skip a few periods and then have a few periods close together.
Menopause typically starts between the ages of 45 to 55, with the average age of onset at 51. Many times it can be associated with a family history. If your mother or your sisters went through an earlier menopause, you might be prone to menopause at an earlier age too.
The physiological changes actually do occur up to 5 years before. As a result, their hormone levels tend to fluctuate. And this actually is the most bothersome to women because it's that fluctuation in their hormones that causes them to have the symptoms that we typically associate with menopause.
Due to the erratic fluctuation of the hormones, women may experience many symptoms of low estrogen, though they won't necessarily be the same woman to woman or even, as I mentioned, culture to culture.
The vasomotor symptoms are hot flashes, which is basically experienced as an intense sudden heat in the upper body. It can last up to 5 minutes, and it can be associated with this just intense feeling of warmth and perspiration and heart palpitations occasionally, as well as this feeling of generalized anxiety can also be associated with it. About 50 to 80% of women will experience hot flashes. Physiologically, we don't really know what is the cause. We know that the lower levels of estrogen and elevated levels of FSH, which is basically your brain's response to lack of estrogen, are implicated as causative, but there are plenty of women who don't have flashes or have different various degrees of flashes. So there are multiple other factors that we don't yet understand that play a role. Many women also note their whole thermoregulatory system is altered due to the fluctuations of their hormones. So that's really what women find the most bothersome.
If a woman starts experiencing typical menopausal symptoms, she should make an appointment with her gynecologist. Never assume that these changes are part of the big change. They could actually be symptoms of another unrelated problem like thyroid disease or diabetes. It's important for a doctor to exclude other medical conditions and make the diagnosis of menopause so that the appropriate treatments can be prescribed.
There are multiple therapies and options that are out there and available. You have to take each woman individually and assess what her risk factors are. But traditionally, we use hormone replacement therapy, which there's been a lot of bad press about the negative effects of hormones. But in the right patient, and in many patients, it is the best option for treatment. There have been many studies on mild antidepressants like Prozac or Effexor that actually work in different ways to decrease hot flashes. You can also treat the symptoms locally. If you have a woman who's never had a hot flash but is is suffering with vaginal dryness and painful intercourse, you can give them local vaginal estrogen replacement therapy, which will reverse all those vaginal symptoms without giving her the risk of breast cancer or cardiovascular events. Multivitamins as well can help. Exercise can help alleviate some of the symptoms of menopause as well. In terms of insomnia, which occurs very often, women get up in the middle of the night with hot flashes. There are things you can just address that issue with occasionally using a sleeping pill or other medications to help you sleep. You can have dietary modifications that actually are helpful. Some women find that adding soy to their diet can help, but you have to be careful because large amounts of soy do mimic estrogen. And if you have estrogen alone without progesterone, or if your estrogen levels are elevated, it can affect your risk for certain cancers. But women have used over-the-counter soy products. There are multiple options out there. You could just increase the soy in your diet, tofu, edamame, and various other things. But they also are in the health food store. You can find different formulations that do help. And I have had many of my patients who find this to be very effective.
There are also a number of alternative therapies available. Relaxation techniques like acupuncture, massage therapy, and meditation are harmless ways to reduce stress during menopause. Herbal remedies like black cohosh, primrose oil, and ginseng promise to alleviate symptoms, but women should talk to her doctor before taking anything. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.